It's a beautiful day in the neighborhood, a beautiful day to ask a gay doc with Dr. Renzo Corzano of Desert Oasis Healthcare. Hey, how's it going?
Good. How are you, John?
Doing great. So we're kicking off the 22nd National LGBTQ Health Awareness Week, and I'm wondering, what should we be aware of?
So I think one of the things that we need to have more awareness on is probably HPV screening in the rectum. And so I think that's something that we should probably talk more about.
Now, HPV is?
Human papillomavirus. I think most people know that as, especially women actually get PAPs, when they get like a vaginal swab in the cervix and everything like that, and they're checking for HPV.
The pap smear?
The pap smear, exactly. Yes, yes. But what a lot of, I guess, gay men don't know is that you can also get a pap smear, but it's an anal pap. And so you're basically checking for the same virus, but it's actually in the rectum.
And this can eventually cause anal cancer.
Eventually, yes. So a lot of the times, like a lot of people get exposed to HPV. Most of the time, we end up clearing the virus, but it's when we don't that we can basically get precancerous cells that can eventually grow into a cancer.
And I'd rather not use the word smear here, but I do like swab. We've talked swab
Yes.
before.
I
So,
call it the anal pap.
yeah, the anal pap, now, does that require you to prep like the day before for like a colonoscopy or?
No, actually, and in fact, you probably should not. And so, can I show you how we do it? Not like on an actual person, but I can show you the tools so people are not too scared of it.
Sure.
Yeah. Okay.
Okay.
So it's really easy. It should take no more than 5 minutes. It can be done by your doctor in an outpatient setting. So we basically take a little, see these little swabs? They're
Hmm.
little, they look like little Q-tips. Okay. And we basically take one of them like this. We dip it in water. Okay. And then we basically go in about this far into the rectum. Okay. And then we turn it, take it out, put it in, take it out, and we rotate a lot inside to get some cells. And then once that's done, we basically just take something like this, it's like a liquid,
Hmm.
and we put it inside and we swirl it. And then this gets sent to the lab, and then they run some tests, and they run two tests. The first test is they're checking for HPV. There's different kinds. And then they also take the cells that we got from that swab and they look at it under a microscope to actually see what kind of cells we see. And then based on that, we make further recommendations.
Wow. I mean, simple, 5 minutes, a
Five
swab,
minutes
and you
tops.
don't have to get all ready for it. And
Do
obviously,
not.
this should not be confused with a colonoscopy. This is also Colorectal Cancer Awareness Month, and you should be getting those tests, and they require prep. But this is
Right.
a pretty simple in-office visit. And it's how
Yes.
often should we get this done if say you're sexually active?
That's a good question. So I would say it really truly depends on what we find, but I would say you everybody should at least have a baseline test done by the time they are technically 45 for non-HIV patients or 35 if they're HIV positive.
Well, this is really good information to have, especially during LGBTQ Health Awareness Week. And if you would like to have a question answered confidentially by Dr. Corzano, send it to lgbtqhealth@mydohc.com. It's Ask a Gay Doc, presented by Desert Oasis Healthcare. Dr. Renzo Corzano, we're going to be maybe talking about getting into the pool soon as temperatures warm up. And I believe in the next one, we're going to be wearing Speedos.
I hope so, with a lot of bubbles, right, to cover us.
Yes, a lot of bubbles. Thanks for being in the neighborhood, Dr. Renzo Corzano.
Of course.